I'll keep it for record.
Can you hear me now? I
Very
wasn't sure if
slow.
I was.
Very slow. Just keep your mic like this, so we can.
Can you hear me now?
Yeah, yeah.
I was wondering why I couldn't see any thumbs up कि कोई मेरी आवाज आ भी रही है कि नहीं.
नहीं सुनाई नहीं. ये सेंस ऑर्गन काम नहीं करते तो हम बिल्कुल आउट ऑफ रेंज होते हैं.
Okay. So namaste everybody. Good morning. My presentation is on hypertension in pregnancy and yoga to cope with gestational hypertension. Before I start, I really want to pay my gratitude to Dr. Nutan ma'am for your class. It has been extraordinarily profound. And this is my humble way of trying to communicate what you put so beautifully. And hopefully I can manage a little bit. Um, I also would like to thank the AYG Academy lecturers who came. So Ms. Deepti, Ms. Neha, Dr. Sarita for their knowledge and for sharing whatever their expertise are with me. I'd like to thank everybody and every event in my life that brought me here, without which I wouldn't be who I am today. And last but not the least, I would like to thank all my classmates and all my batchmates for their constant encouragement and sharing their life stories and their journeys and their learning with me. I think I'm an eternal student, not only from Nutan ma'am and her team, but also all of you. So thank you so much. Um, So this is kind of an overview before I go into gestational hypertension. So there are a lot of challenges that some women face when they're pregnant, and they can be broadly categorized into three. So complications that occur during their pregnancy, um, during delivery, or postnatal complications. That basically means after the child is born. Now, in Western science and terminology, um, the the complication doesn't highlight who is facing it, and this is kind of my understanding from ma'am's lecture, that in Ayurveda there are specific terms to highlight who faces the complication. So, for example, Garbha Vikruti is what the mother faces, and Garbhini Vyapad is what the child faces. So here are just an overview of some of the complications that occur. So when a woman is pregnant, she can either she can probably face gestational diabetes, which Nikhar did a beautiful job in explaining, gestational hypertension, and sometimes varicose veins as well, which is what I will kind of go into. And sometimes women can also face anemia, which basically means that the hemoglobin falls below 12 milligrams or 12 micrograms. There could be defects in the structural. So the structural defects that pregnant women could face would affect both the woman and the fetus. So that would be defects in the placenta or the umbilical cord. So placenta previa, which Dr. Sarita had also explained to us, where the placenta covers the cervix. So if there is a rupture in that, or if there is spotting, there's a potential that the pregnant lady can face a lot of bleeding, and her hemoglobin can drop, she can be anemic, and that causes a lot of issues. So that also needs to be addressed. There could also be fetal defects. So it's called IUGR, or intrauterine growth retardation, which affects the child, where the child has not got enough nutrition or nutrients. There could also be miscarriage and congenital abnormalities. So this is a broad overview of some of the pregnancy complications, and I will be focusing on gestational hypertension. So what is gestational hypertension? We have all heard the word hypertension a lot of times, which is vaguely associated with high blood pressure. Gestational hypertension, and this is explained by Stanford Healthcare, is a disorder that develops halfway through pregnancy. It typically happens 20 weeks into the pregnancy for a woman. And from Stanford's data, about 5 to 8% of all pregnancies usually end up with gestational hypertension. And that's most of the time goes away after the lady gives birth. Um, gestational hypertension is diagnosed when the blood pressure readings are higher than 140 by 90 mm per Hg. And this is typically in the second trimester of a woman's pregnancy. Normal blood pressure reading typically is 120 by 80. So there are different types of hypertension. So one is chronic. Chronic is when the lady has a history of hypertension prior to the pregnancy. That basically means that hypertension's onset was not during the pregnancy, but before the pregnancy. And this is one of the reasons why, in addition to a lot of things that we've already learned, where history is very important. The reason being is if we know that the woman has a history of hypertension, then we can sorry, if you know that the lady has a history of hypertension, then we can watch out for her manifesting gestational hypertension, which could affect the fetus. So that's chronic. So gestational hypertension would be where the hypertension onset happens after the lady has got pregnant or she's conceived, and this typically happens in the second trimester. The reason why it is important and why one needs to take care of it or address it is because it could lead to preeclampsia or eclampsia. So what is preeclampsia? So preeclampsia is when a woman who is diagnosed with gestational hypertension also has findings of protein in her urine, which basically means that the liver is not breaking down the protein, and therefore the body is throwing out the protein which is required for the baby's development. There could also be signs of damage to other organs, sorry, such as the kidneys, liver, blood, and that can also, or the brain. And this is again important because if the mother is not getting the nutrition, the child doesn't get the nutrition. And that is seen because protein should not be found in urine typically. So that's a kind of like a red flag. So what are some of the symptoms of preeclampsia? So there's proteinuria, which is protein in the urine. There could be severe headaches, change in vision, upper abdominal pain, nausea, vomiting, and sudden weight gain and edema. So sudden weight gain is weight gain which is not considered normal. Like a woman who is pregnant typically gains weight. This is not in association with that. This is a sudden surge in weight. And edema is water retention. So Dr. Nutan ma'am was talking to us about pitting, right? If you press the skin, it should typically bounce back. But if it takes a while to bounce back, that basically shows as water retention and swelling that the woman is going through. Eclampsia is a severe form of preeclampsia. So if preeclampsia is not taken care of and not treated, it can result in eclampsia. And what that basically means is, I'm almost done. What that basically means is that the woman is presents with seizures. So these could be grand mal seizures. Sometimes there can be an absent seizure, and you may not know, but typically it's grand mal seizures where the woman visibly has seizures, falls on the floor, and her body is in fits. That can impact both the woman and the child she's carrying, and hence it's important to take care of it. This is the chart. I looked for a lot of things. Ma'am has explained it the simplest. So ma'am, I borrowed this from you, where there are different types of hypertension. This is basically a recap of what we were talking about, which can be divided into gestational and chronic. You can have gestational hypertension without the protein in the urine. You can have preeclampsia with the protein in the urine, and you can have eclampsia with grand mal seizures. You also have something called HELP syndrome, where H stands for hemolysis. That basically means that the red blood cells in the blood are broken down too quickly, which could lead to anemia and hypoxia. That the blood, because the blood cells are broken down too quickly, the blood cannot carry oxygen, and therefore there is reduced oxygen both to the mother and child. The EL stands for elevated liver enzymes, and the LP talks about low blood platelets, sorry, and low blood platelets can cause excessive bleeding because platelets are responsible for clotting. And preeclampsia can present itself with or without severe features. Now, this is an issue because, like I was saying, it can reduce blood flow to the placenta. It can result in placental abruption. You can have IUGR present. It could injure other organs for both the mother and child. It could result in premature delivery, and it could also lead to future cardiovascular diseases. Therefore, it is very important to address this issue. So how can you address this issue? So there are two ways you can address it. One is through diet and the other is through yoga. So diet should be high in natural fats, should be moderate in protein because high blood pressure can cause protein in the urea, which basically means it's hard for the body to digest protein. So it should be moderate in protein, not too much where the body is going to be in strain to digest it, and lower in carbs. It would include fresh vegetables, high in nutrition, and include for people who eat meat, liver, red meat, and eggs to basically get that nutrition and nourishment that the body requires. In terms of yoga, yoga helps in for labor and relieving pain, increasing better sleep and quality, building stamina, better birth position for the baby. And all of this is helpful in controlling the hypertension part. So some of the specifics would be breathing, gentle stretches, stability postures, cool down and relaxation. So in specifics, so the asanas would be Sukshma Vyayam, modified Shashankasana, Viprita Karni, Pranadharana, Supta Baddhakonasana, Virabhadrasana, Shavasana, Pranayama, and meditation. All of this to basically give stability, cause the mother to calm down. And also in the Pranadharana, if she talks to her baby, that will also help calm her down and reduce um, her stress and her anxiety. So that's kind of a little bit about it. It's a vast topic. I tried my best. I know I went over time. I'm sorry for that. And these are my references. So if any questions, I'll be glad to answer them to the best I can.